In January, I knew something was happening with COVID-19. I contacted a colleague of mine, Ben Cowling, at the University of Hong Kong. He was working with the Chinese CDC and had access to data from Wuhan before they put their social distancing in place. And this data was some of the transmission characteristics of this coronavirus. So we took our influenza model and we modified these parameters in the model. So we then had a COVID-19 model. Using that, we were engaged by the WA Health Department as part of their COVID-19 response team to use our modelling to evaluate alternative social distancing intervention strategies for Greater Perth. So that's 2.2 million people. And then what that gave us was daily infection rates. How many people were becoming infected each day. And we then looked at social distancing measures that could modify that rate of transmission. So the daily rate, you could, as they say, knock the curve back, flatten the curve. In our model, because it's individual based, we capture the infection profile of each individual. So whether they're non-infected, which is called susceptible, whether they're infected not yet infectious, whether they're infectious or whether they're recovered and immune. So daily, every day, we could count up the number of people that were infected on that day and for how long they were infected. So every day we knew how many infectious people there were in Greater Perth. And then we looked at social distancing interventions to modify that. By clamping down, we could reduce that and we would see the effect of that as we run forward. So what we were doing is taking live data from WA Health, putting it in the model, and then running the model forward to predict where we would be in a week's time, 2 weeks, a month, 6 months, 12 months. And then we would do it with an adjusted social distancing in place and see what the difference was. So we were able to generate different epidemic curves. A third of all infected people will not exhibit any symptoms, and half of the remainder, so that's a third of those infected, would be very symptomatic. So these are the ones that these numbers were what we used to calculate hospitalization rates. From hospitalizations, we can calculate ICU bed demand, and we can calculate deaths as well. Of course, the pandemic really didn't emerge in most of Australia, or anywhere in Australia really, but particularly in Western Australia, in any serious sense of the word. But the good news was we had a model that we could use and ready to go. If we'd had to develop this model, we would still be developing it now. So that's a lesson to be learned. We need to have this modelling infrastructure in place for future pandemics.